Welcome to this capsule that will introduce the management module. My name is Catherine Schneider and I'm a physiotherapist and researcher at the Sport Injury Prevention Research Centre at the University of Calgary in Calgary, Alberta, Canada. Following this module, you will be able to describe the general principles of the management of concussion. You'll be able to identify key factors to consider when gradually returning to cognitive and physical activities after concussion. In this module, you will learn about the science behind the initial management and recovery of concussion, including key points that need to be considered when returning to school and sport. In this presentation, I will review the initial management of concussion and provide an overview of rest and activity recommendations following concussion. We heard in the last module that it is important to recognize and remove when a concussion may have occurred. Once the player has been removed, they should be referred for medical follow-up so they can be reevaluated to confirm and negate the diagnosis. It is recommended that this is done using a multifaceted clinical examination. Based on the current research, an initial period of rest of 24 to 48 hours is recommended until the acute symptoms resolve. This includes both cognitive and physical rest. After this time period, individuals can gradually return to their activities of daily living as tolerated and within their symptoms. The term subsymptom threshold is often used and means to stay just below the level at which your symptoms would be stirred up. Your activities should not bring on or worsen your symptoms. Cognitive and physical rest is recommended, and further research is ongoing to learn more about the exact amount and duration of rest that is best. Recovery. We do know that most people will recover in the early time period following concussion. In adults, that's typically within the first 14 days, and in children and adolescents, it can take up to 4 weeks. Some people might take longer to recover, and there is some research that can now identify which factors predict who may take longer to recover. You can learn more about this in the capsule on predicting recovery following concussion. Once concussion-related symptoms are gone, it is then recommended that an individual gradually progress through the return to sport and return to school strategies. A minimum of 24 hours should be taken at each step, so the entire process should take approximately 1 week if no symptoms recur. Both the return to sport and school strategies can be performed simultaneously, but it's important to consider the concept of risk and when risk is reintroduced. It is recommended that medical clearance occur prior to returning to contact training or any risky activities. You will learn more about the details of these strategies as you work through the capsules in this module. Rehabilitation, that will be covered in the next module. Some people do benefit from rehabilitation if they don't recover in the initial days to weeks following concussion. The process of referral to rehabilitation and access to different types of healthcare professionals will be covered in the next module. So what can you expect in this module? You'll see an overview of the initial management of concussion, including rest followed by gradual reintroduction of activity, learn about predictors of recovery, learn about the return to sport and return to school strategies, and you will also see applied examples of how this works in different settings to provide ideas that you can apply to your own setting. Enjoy the module.